pop before we can finish. I realized it long before I gave it up. I think it's a highly variable and individual issue. It has to do with what resources they have to heal. It has to do with what support they have. It has to do with what cost this habit is exacting on their lives. It has to do also with some belief that there's a part of us that's actually healthy and we can get in touch with it. There has to be a whole combination of factors. And it's very, very individual. It also depends, of course, the degree of trauma a person suffered. And addictions are always about, like, you've heard my definition of addiction, and I'm sure if I asked you, like if I asked, from talking to 1,000 people, put your hands up if according to my definition you've got an addiction, virtually everybody in the room will put their hands up. Maybe there'll be 2 liars who keep but 998 would. And then I asked them, not what was wrong with the addiction, but what was right about it. What did you get from it? So what I'm saying is that addiction is never a choice, and it's not some kind of genetic disease, which that is total nonsense. What it actually is an attempt to solve a problem in your life. In your case, you were trying to solve the problem of being trapped, which is based on your childhood trauma, which you very publicly talk about. In my case, the workaholism was about trying to prove to myself that I had the right to exist, that I was important.
You're worthy of love.
That I was worthy of love, exactly, acceptance and all that. No, that also came from my childhood experience. So addiction is never like either a disease as such. It can behave like a disease, but it isn't a disease as such.